Hi, and welcome back to Abnormal Psychology, where we're going to be looking at feeding and eating disorders and sleep and awake disorders. All right, isn't it kind of sort of surprising in a way that in Canada, a country of plenty, that some people would starve themselves even to death? In these more modern times, with a proliferation of advertising, movies, internet, social media, images of desirability and the ability to communicate and comment on one another's images is facilitating this struggle that some people have with their weight. They want to be thinner is most common. Sometimes dysfunctional and unhealthy choices are exercised. Binging and purging, extreme maladaptive eating patterns are the focus of the first part of Chapter 8. Eating disorders like bulimia nervosa, and anorexia nervosa often affect people of high school or college age, especially young women. Now, these disorders are on the rise in Canada. Let's consider Beth. At first, she was eating too much, and she would just go to the washroom and make herself sick. She was not aware of bulimia and was beginning to eat based on how she felt about herself. When her hair looked bad, she would eat loads of candy. After a while, Beth started exercising excessively because she felt so guilty about her eating. She'd run for miles and miles and go to the gym for 3 to 4 hours a day. I'm sure you can see the risk Beth is putting into her life. Now we're going to explore feeding eating disorder descriptions, theoretical perspectives, and treatments first in part 1. And then we'll do sleep and wake disorder description, theoretical perspectives, and treatment will follow in part 2. Let's get beginning with part 1, feeding and eating disorders. Feeding and eating disorders are psychological disorders involving disturbed eating patterns and maladaptive ways of controlling one's body weight. And we're going to start with anorexia nervosa. Anorexia nervosa is an eating disorder primarily affecting young women, and it is characterized by maintenance of an abnormally low body weight, distortions of body image, and an intense fear of gaining weight. A risk in females is amenorrhea, which is the absence of one's menstruation. Another risk is osteoporosis, a calcium deficiency resulting in brittle bones. Now there are two subtypes. There's the binge eating purging type, and it utilizes, in order to lose weight. But unlike bulimia, a person maintains their weight. And then there's the restrictive type, obsessive-like control over their diet and appearance. We'll move into the bulimia nervosa, which is an eating disorder characterized by a recurrent pattern of binge eating followed by an inappropriate compensatory behavior such as purging eaten food, either through vomiting or through the use of laxatives. To prevent weight gain, it is accompanied by persistent overconcern for body weight and shape. Now, as I mentioned, there's a term there, binging. Well, binging, people with bulimia nervosa may cram thousands of calories during a single binge and then attempt to purge what they have consumed by forcing themselves to vomit. Medical complications of bulimia, typically repeated stomach acids from repeated vomiting can cause skin irritations, blockage of salivary ducts, decay of teeth enamel, and dental cavities. Pancreatitis, the inflammation of one's pancreas, and abdominal pains from these cycles of eating and binging. Potassium deficiency producing muscular weakness, cardiac irregularities, even sudden death. It's extremely serious. My sister went through 3 years of anorexia nervosa, and it's not a fun thing to go through. Causes of anorexia and bulimia. Well, it involves a complex, as most of these do, interplay of biopsychosocial factors. Increasingly, researchers are finding that eating disorders arise when underlying genetic and neurobiological vulnerabilities interact with the social pressures felt by young people that lead them to put a high value on their physical appearance, especially their weight. Sociocultural perspective, while eating disorders appear more frequently in North America, interestingly, social expectations for women and even men to match with an unrealistic standard. As you can imagine, media plays an important role in promoting these unrealistic expectations for thinness and the development of negative body image. Psychosocially, well, here the considerations are focused on what people might be thinking and focusing on. Their weight, body dissatisfaction, which can lead to more extreme concerns for one's body and weight. Women suffering from bulimia tend to be shy and have more psychological problems and lower self-esteem than some of the other dieters around them. What role might family play? Well, eating disorders and families and family of conflict often coexist. So whether the eating disorder is a means of exerting control or punishing parents is one bit of the research. Biologically, neurotransmitter serotonin and the reward centers are considered important to understanding bulimia, especially bulimia. The relationship between increasing serotonin and decreasing binging is shown to be promising. Other neurotransmitters and eating disorders are being further explored, as a role of impulsivity might be at play with a couple of the neurotransmitters. Now, treatment of anorexia nervosa and bulimia nervosa. People with anorexia may be hospitalized, especially when the weight loss is severe or body weight is falling rapidly. Close monitoring, regular feeding regimes are emphasized. However, these are often met with resistance. This sometimes results in forcing more mechanical, like feeding tubes, or chemical restraints to support weight gain. The best outcome results come from treatment that involves psychotherapy combined with nutritional management and family interventions. Other therapies that benefit patients with eating disorders are cognitive analytic therapy, behavior therapy, and cognitive behavior therapy. We can touch base on one that's known as the cognitive analytic therapy, and it's aimed at helping a patient learn new approaches to their food and eating. The family therapies are useful in helping an attempt to help to identify and resolve family issues and family conflicts, or parenting styles to assist the patient with coping and the family with coping. Cognitive behavior training, well, the pairing of correcting faulty thinking with an almost phobic treatment strategy, a phobia treatment strategy. So that if you remember when we talked about phobia, the treatment with that was a lot of times was incrementally increasing more access. So it was desensitization through incremental hierarchy. Binge eating disorders, BED, is an eating disorder characterized by repeated episodes in which binge eating occurs but is not followed by purging. All right, that's a quick completion of our review of feeding and eating disorders. Now in part 2, as I mentioned, we're going to look at sleep-wake disorders. We'll see you in part 2. Bye.